Coming up, we'll be on location at Care Dental in Tysons Corner, Virginia, discussing the latest advances in dentistry, including Invisalign, dental implants, and more, and how they can give you that beautiful smile you've always desired and improve your oral health with one of this area's top dentists, Dr. Rahat Aziz. Welcome, Dr. Aziz, to the Top Doctors Interviews program.
Thank you so much for coming today. I was looking forward to it.
All right, we've got a lot to talk about. We're going to touch on Invisalign, dental implants, and other cosmetic dental treatments as well. But before we get into that, I wanted to touch on your background, Dr. Aziz. You're recognized as a top dentist throughout the Northern Virginia region. You've helped so many patients improve their smiles, their oral health, get their confidence back. So I wanted to ask you about your vision for your practice here at Care Dental in the Vienna-Tysons area.
Our vision for our practice is to create a welcoming and non-judgmental environment for all of our patients. Also, at the same time, a lot of the patients that come to us, they're anxious, so we strive to provide them a stress-free environment. We utilize the latest technology in our clinic to give the best outcome for our patients, and we want to provide a family-like environment to the patients so they can come and relax and have a positive dental experience and leave here with a beautiful, healthy smile.
You offer a lot of great cutting-edge treatments here. Can you tell us about some of the most effective treatments that you offer, Dr. Aziz?
So we provide all kind of treatments that fall under the umbrella of the general dentistry. That includes Invisalign, implants, crown and bridges, veneers, extractions, digital dentures, fillings.
So let's focus on like Invisalign and dental implants today. Dr. Aziz, what is Invisalign, just for viewers who may not know?
Okay. So Invisalign is the most trusted aligner company that's been out there for a long time. What Invisalign does, they create smart force aligners that move the teeth in small increments, just like traditional braces, to give patients straighter, more beautiful smile.
And what would you say are some of the key differences or benefits of Invisalign as opposed to traditional braces?
So I personally like Invisalign more. You can get the treatment done faster compared to the traditional braces. It's a lot easier to maintain the oral hygiene. You can remove the aligners, brush and floss your teeth properly. So there's less risk of cavities with Invisalign compared to the traditional braces. Also, Invisalign is more comfortable to the patients compared to the traditional braces. There's no poking wires, there's no brackets coming off. You don't have to go to the dentist over and over again.
That sounds like a great option. When I was younger, I had braces, and I remember all the discomfort. They would tighten the wires, food would get stuck in there. I really wish Invisalign was around back then because it seems like a no-brainer.
Yeah.
So is Invisalign something that any patient can utilize, or are there restrictions, or is it limited to certain types of cases?
So we have to evaluate the patient when the patient comes in. We have to determine that the patient is candidate for the Invisalign or not. You have to be compliant. If the patient is not compliant and I think they're not going to wear the aligners, I don't recommend Invisalign for those patients. Also, some patients, if they have skeletal problems that require orthodontic surgery, Invisalign is not an option for those patients.
And then as far as Invisalign goes, is it something that you have to wear all the time, or like when you speak in front of the public, or if you're at your job, there's the option to take them out?
These are clear aligners. They're hardly visible, so you can be speaking to the public and it wouldn't be noticeable. You have to wear them 22 hours a day. So the maximum they can be out of your mouth is 40 minutes. The only time Invisalign, the aligners are not in your mouth is when you're eating and when you're brushing your teeth.
And what kind of results have your patients been seeing from Invisalign?
They get great results. They have straighter teeth. They're happy with the smile. And it also benefits their teeth health too. So there's less risk of cavities and they can brush their teeth easily. So all our patients have been very happy with the results.
And what is the patient process, Dr. Aziz? Say a patient is interested in Invisalign and they call your practice, like what can they expect?
As I mentioned earlier, the first step is evaluating the patients. After we're done evaluation and they have no cavities and the mouth is healthy, then we proceed with the Invisalign. The process is very simple. We take just some of the profile pictures for the patient, and we have this digital scanner. We scan the patients, maybe takes 5 minutes, and then I have to sit there, change the position of the teeth in the software. And once I'm happy with the results, I finalize the case and goes to Invisalign, and they send me the aligners for the patients.
Again, that sounds like a great option when you're comparing it to, having traditional braces and everything you have to go through. It seems like a much better option for patients.
Definitely.
And you also do dental implants here at your practice as well. Can you tell us what dental implants are?
It's basically a screw that's placed in the jaw to replace missing teeth. It could be one missing tooth or multiple missing teeth. We have very high success rate, which is 98% with dental implants. We're not damaging adjacent teeth to do bridges, and they don't come out when the patient is talking or functioning. So it's a great alternative to replace missing teeth.
You mentioned one of the benefits where you don't have to remove dentures. What are some of the other benefits of getting dental implants compared to the other options?
So to replace missing teeth, we have 3 options. One is the removable partials that the patient can take in and take out. A lot of the patients, they don't like that. And the other fixed option we have is the dental fixed bridges, where we have to cut the 2 good teeth to give them the missing tooth. It's hard for the patients to clean the fixed bridges. Patients end up getting a lot of cavities because it's hard to floss under the bridges. So dental implants preserve the natural teeth, and it's like getting your own tooth back.
And Dr. Aziz, what is the patient process for dental implants? When they contact you and they're missing teeth and they want to know more about dental implants, what can they expect?
As for any dental treatment, we first always have to evaluate the patient. If the patient is a candidate for the implants, we have advanced dental technology these days. We do a CBCT scan for the patient, and we take the scan of their teeth as well. And we do guided implant placement. Guided implant placement is more accurate compared to the traditional way of placing the implants. It's more precise and it's more comfortable to the patient, as there's no cutting of the gums involved in the process. And the outcome is much better for the patient, and there's very less discomfort associated with this process.
So you offer dental implants, you offer Invisalign. What are some of the other key treatments that you offer here at your practice?
We do teeth whitening, we do crowns, bridges, digital dentures, fillings, extractions.
Well, Dr. Aziz, that was very informative. It was a pleasure coming out here to your beautiful practice here in the Vienna Tysons area Care Dental. It helps so many patients, again, improve their oral health, get those beautiful smiles. Thank you so much for being a guest today.
Thank you so much for coming today. It was nice talking to you.